Waking up so sick that you are unable to do your daily task is never fun. When was the last time you were so sick with a bacterial infection or virus like the flu? Did you wish you would have been able to prevent it? Parents should keep their children up to date on all vaccinations in order to prevent them from becoming sick, as well as stopping the spread of diseases, viruses, and bacterial infections. As a child, my parents made sure I was always up to date with all my vaccinations. Because of this, I never became sick with anything that I was vaccinated against. During my speech, I will share the benefits of getting vaccinations on time, as well as explain the reasons why you should vaccinate your own children. By getting vaccinations, you are able to prevent the spread of diseases, viruses, and bacterial infections, as well as lower the chance of becoming sick. You are always going to be exposed to germs, so why not prepare your body for when you do become exposed to these germs? Everyone gets sick at some point, but vaccines help to lower the risk of getting contagious viruses and infections. Vaccines are a great way to stay healthy. You may be wondering exactly what is a vaccine. According to the CDC, a vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, protecting that person from the disease. Immunizations are made up of dead viruses or bacteria that prevent and prepare the body for when you come in contact with these germs. By being injected with a small portion of these viruses, your body creates antibodies that help to prepare it for when you become sick. In her article, Impacting Parental Vaccine Decision Making, Amy Zanger-Eby writes for Pediatric Nursing says, with the help of vaccines, people are able to build antibodies that enable and create a defense against illnesses such as rabies, tetanus, influenza, measles, pneumococcal, meningococcal disease, hemophiliac influenza, and other vaccine-preventable illnesses. Effects of not vaccinating not only affects you, but also all of the people that are around you. When you go on vacation and touch the same door handle as someone else who may be carrying the flu virus, you are sustainable to getting that virus. Whether you are vaccinated or not could determine the outcome of whether you become sick. An example of this case from a few years ago, Amy Zanger-Eby writes, as of April 10, 2015, there was one large measles outbreak at a Disney theme park, contributing to smaller outbreaks in 18 states and causing a total of 159 cases of measles during early 2015. We are living longer and healthier lives because of the vaccinations that have become created. Before vaccines were created, lots of germs were spread around from people to people and from community to community. With the vaccines we have today, we are now able to help prevent that spread. We no longer have to worry about the threat of smallpox, one of the world's deadliest diseases, because of the vaccines that have helped to eliminate this deadly disease. Statistics are able to prove the impact on life that vaccines have had. According to Colorado Children's Immunization Correlation, Benefits versus Risk, in 1 year, vaccines prevent more than 8,500 child hospitalizations in Colorado, 33,000 deaths in the U.S., and between 2 and 3 million deaths worldwide. Vaccines have almost eliminated diseases such as smallpox and polio, and have helped people who chose to be vaccinated live healthier and longer lives. More people need to understand the benefits of being vaccinated. Vaccines do more harm than good, like many people believe. According to the National Foundation for Infectious Diseases, in the top reasons to get vaccinated, vaccines are among the safest medical products available and can prevent the suffering and cost associated with infectious diseases. There are many reasons people do not get vaccinated. Among the top reasons is because people are afraid of the allergic reactions that they may have, and because they are afraid that it may shut down their immune system. Many people also are afraid of the toxins such as mercury and antifreeze that come along with these vaccines. They also believe that they do not work, and a recent belief is that they are one of the main causes of autism. Not getting your vaccines not only affects you and your family, but it also affects all the people around you. When you become ill in your everyday life, you could easily pick up germs and spread them even to people at work. When you do become sick, you have to miss many days of work, and you have to cancel your plans, whether it be with family or friends, or even going to the movies. According to Cynthia G. Whitney in Benefits from Immunization during the Vaccines for Children program area United States, vaccine is one of the most effective public health interventions. A lot of the older generation has began to believe that vaccines do more harm than good. P. Benoa, writer of Lifelong Vaccination as a Key Disease Prevention Strategy, says, "It's also worth noting that at least 80% of those aged 65 years and older suffer from a condition of chronic illnesses that indicates the need for the administration of certain vaccines." Now I want you to imagine this scenario. Imagine you and your family go to the movies to see the new superhero movie that just came out. You get in line for snacks and drinks and talk about how excited you are for the movie. Your kids see some friends from their school and they say hello and give them hugs. You are up next in line, and as you walk to the counter, the friendly worker who just turned on the popcorn machine comes over to take your order. She smiles and says hello, pauses, then sneezes, says excuse me, and continues to take your order. The movie starts and you quickly pass out all the snacks and drinks, including the buttery popcorn that was just popped. Later that night, back at home, you and your family all begin to run a fever and quickly become very ill. By the middle of the night, you are taking your whole family to the emergency room. You tell them your symptoms of a fever, sneezing, and coughing, and the feeling to need to throw up. They immediately take you into the isolation waiting area where you see your kids' friends from school and the movie theater worker. This is how easily an outbreak can happen. Vaccines have eliminated horrible diseases such as smallpox and reduced the numbers of outbreaks of measles and even the flu. It has continued to help people live longer and healthier lives because of the less likelihood of dying from these diseases. Parents should conduct their own research on vaccines and consult their doctors regarding vaccinating their own children. You should not listen to what other people say because their reasons may be different than your own. As science continues to improve vaccinations, children and adults need to become aware of these improvements and stay current to help prevent them from becoming sick. It is well documented and discussed in my speech that vaccines have helped to save lives, eliminate many deadly diseases, and continue to allow people to live longer lives without the fear of becoming sick. Children who are vaccinated are almost 100% less likely to catch these disease and become sick or die. Vaccinations are covered by almost all insurances or provide no cost at state health programs because of the importance to help prevent these kids from becoming sick. My children will be vaccinated. Will yours?